going to look? Do we know anything about
Breaking news right
Well,
now.
that's a fair question, and while it's a little
President
early,
Donald
I imagine
Trump
you
has
and I will
tested
learn a lot
positive
more
for
in the
COVID.
hours ahead. I can definitely tell you this, based on previous circumstances like this, meaning something big happens overnight.
This is late breaking
There's usually a
news.
statement or two that's issued right away, and then in the morning, sometime around 5 or 6, they'll all get together, they'll make sure they have their marching orders for the day, and then they'll usually roll out one by one, either personnel by way of a press conference or a news conference, or more and additional statements. I'm sure we will hear from the medical staff, for example, here at the White House at some point later today. As for the Biden team, you probably heard last night that they're going to start being a little bit more aggressive too, or at least they hope to be, in terms of getting out there doing some door-to-door work on the campaign trail. You would have to wonder now what that might be like as the two campaigns battle it down to the very last moment of this all-important election. We have not heard anything official from the Biden campaign, at least not the last time I checked my notes, and it's still a little bit after 3 in the morning here in the East Coast. If I get something, I promise to pass it along. But we got
3 in the morning on the East Coast.
The entire world now is waking up and reacting to
Breaking
this
news.
President and First Lady.
After exposure than somebody who, say, is asymptomatic? Is there a huge magnitude gap in infectiousness? If somebody has a lot of symptoms, has a fever, has a cough, has a low oxygen sac, for example, what is she feeling? And this is where I would say it's really vital. Let's forget what's happened for the last 8 months for a moment, if we can, just for the moment right now. If the White House could overshare information on what's happened with Hope Hicks. When did she develop symptoms truly? Because here's the thing.
The president Tuesday, Wednesday, I find it incomprehensible that they would allow the president of the United States to go for the entire day of Thursday without getting tested until just before he went on Sean Hannity. I mean, that just seems... Sanjay, just from a medical... Yeah. Sorry, go ahead.
Yeah.
Dana?
I was just going to say, I just want to tell you that I do have a very good understanding of how negligent the White House was when it comes to so-called contact tracing. I mean, remember, not only has the president been, with his aides who have been with the press, he's not only been on a plane going to different places, he also was preparing for a debate, and he had a lot of people around him. And my understanding is that a lot of people around him for hours and hours in a very small room, not wearing masks. And my understanding is that some of those people didn't know about Hope Hicks testing positive when they should have known.
Right.
I mean, that just kind of tells
I think
you
that's why he was a little off his game during the debate.
Sanjay, again, Hope Hicks...
He didn't know he was interrupting so much.
Or she's the one we know tested positive first. We don't know exactly when. We believe...
This is the worst possible news we could get.
That it would have been Thursday
We need
morning.
to pray for our
She was
president.
feeling symptoms Wednesday. Is it possible she was infected, that she had it Tuesday, or somebody else had it Tuesday when they were at the debate? Should Vice President Biden now get immediately tested?
Well, I think the answer to the question about Vice President Biden is yes. He does need to get immediately tested. There is an event now that has occurred where he's come in proximity to someone who has COVID. And as you well know, you can, going back to Hope Hicks, you can be very contagious. Some argue even more contagious before you develop some of these symptoms. It's that pre-symptomatic period. So, trying to tie the timeline here to the testing, may not reveal much, because you could have the virus, you could have even be contagious before you develop symptoms.
Terrible news.
Was the president potentially the
Terrible
one
news,
who
people.
spread this virus to Hope Hicks, for example, even though Hope Hicks had symptoms first?
And I mean, on that debate
The
stage,
president's
they may have been socially distant, but there was a lot of yelling and spewing and,
Right.
liquid coming out of mouths while yelling.
Yeah, and it's not an exact science, right? They say 6 feet. We're going to keep you 6 feet away, which, they're trying to be cautious here, understandably, but this is not an exact science, and you're inside. We have learned a lot about this virus even over the last several weeks, last several months, in terms of the idea that it could become aerosolized, right? So it's not just 6 feet away. If you're indoors, the idea that you think of the virus more like potentially like smoke, like it actually could could waft into the air. That's why you got to be so careful. But to answer your question, the vice president absolutely, former Vice President Biden absolutely has to be tested. I'm sure they have probably considered that already. He may know about this already. But also going back to President Trump's testing, who knows what happened there? Maybe he did get tested and it came back, and then they said, well, let's test again. You know, we're not sure about the result, let's do it again. And so they were waiting for a confirmatory test. Regardless, Anderson, I think to your point, it doesn't matter. He had a close contact with someone with COVID by, I guess,
Once
Thursday
again,
morning. Yes, what day?
the numbers are saying over 70, 95% chance of survival. So this is big news. We keep the president in prayer and in our thoughts.
So that's very concerning. And again, you know, I mean, we need full transparency here. It's not just about the health of the president. And we obviously, statistically, and odds are that he will do well and recover from this. But it's everybody else now.
This is terrible news.
With this news that they'll wake up to, or have already perhaps
Terrible,
woken up
terrible
to
news, people.
as the word spreads. Tell us a little bit, Abby,
Wow.
put your White House physician hat back on for a moment, because I'm curious now what would be happening in the White House residence. How do they handle, what protocols do they put in place now? You have the resident staff, and then, of course, the president will have to be meeting with his staff. We know, by the way, Mark Meadows, in his most recent test, which is near daily, tested negative, a good sign. But how does he both work with his staff and then also in the residence?
Well, you know, he is the President of the United States, so he's going to have to continue to do his job to some extent, but he won't be able to be completely 100% isolated from anybody and everybody at the White House. And there will be other people, you know, obviously the chief of staff and people, you know, that are key to running our country. They will have to continue to interact with him. So they'll take precautions. You know, obviously everyone will be washing their hands thoroughly. They'll be wearing masks. They'll be doing social distancing. But he'll still be able to conduct business within the White House, although the number of folks that are around him on a day-to-day basis will shrink rapidly. You know, and there won't be near as many people that will be, you know, in the room with him. But the key people that need to be there to get the job done and for him to continue to function as our president, those people will be there. And, you know, like I said, they'll take precautions, but they're out there and they'll take...
Donald and Melania.
...necessary to continue to lead our country.
Melania's got a much better fighting chance.
I think we'll be fine.
But we got to pray for our president. 5% chance of dying from the disease. So this is 95% chance of survival.
With the president and first lady.
Big news.
Well, I'm not really concerned all that much about his health. I honestly think, I fully believe that he's very healthy. And I know this from having been his physician for a few years. And he's in a great position physically to weather this. And I think that we, you know, there are lots of people out there that are in his age group that do very well with this if they don't have the comorbidity, and he doesn't. And like I said, you know, there's...
We gotta pray that the president gets through this.
Diabetes, pulmonary disease, you know, COPD,
Because
emphysema, things of that nature. And the president doesn't have any...
it's all over if he doesn't.
I suspect, you know, the president...
It's a wrap.
And this is what I'm hoping. It will be like many Americans that found out that he had this somewhat incidentally because of the exposure to someone else who had it.
The grand experiment.
He won't develop symptoms. He'll go through
240-year American experience. The experiment of democracy. You might as well throw in the towel if he doesn't get through it.
Well, that's a big question, isn't it, Dr. Jackson? We're learning from the White House daily schedule that we were given that the president had a fundraiser on the books and would ultimately travel to Florida tonight. That now has been postponed. You mentioned we now would look for at least a few negative tests. Is that what your thought is before they would even consider pulling the president out of isolation?
Yeah, I think, you know, from this point forward, most likely what's going to happen is they'll wait, you know, 8 to 10 days, probably closer to 10 days before, you know, they fully engage on things again. And during that period of time, they'll probably expect him to have 2 negative tests. And so I think if he goes, continues to be asymptomatic for the next 10 days, continues to do his job from the White House with a reduced staff around him, and then he ends up testing negative two times, during that period of time, that they'll be able to reliably and get him back out to interact with folks in the way he needs to finish out this campaign cycle and obviously go back to being president of the United States in the way they were accustomed to.
Dr. Jackson, I want you to wear your other hat, which is your retired Navy Rear Admiral. This news certainly has national security implications, perhaps. What are your thoughts?
Well, it does. I mean, anytime, the president of the United States and the leader of the free world is confronted with something like this, it's going to have some national security implications. But I think that, we just have to, reassure the world that, the president is still the president. He's still healthy. He's still asymptomatic. He's still in control. And, and he's still running our country and leading the free world. And I think that if we message that properly, we can reassure folks so that he can continue to do his job. But you're right, it's inevitable that that's going to have there's going to be some ripple effect.
Dr. Jackson, how important is that contact tracing? You mentioned, obviously, that is in full force now being done.
He puts himself in danger.
Tell us why that matters.
Every day. For us. For the country.
They're not going to know exactly, right now.
Our POTUS and our floaters.
Exactly when the president.
God bless them.
When he got this. He was in close contact apparently with Hope, and Hope has tested positive now, but that doesn't mean that was the person that he got it from. I mean, it could have been even.
I blame it all on Hope Hicks.
Go back and start talking to people that that were around him for the last few days and ask him, did you have any symptoms, and find out if there was anybody that tested positive they were unaware of that might have been in touch with the president even prior to Hope Hicks. And then it'll affect everybody that's been around the president, because they'll, to some extent, be obliged to quarantine themselves.
She keeps touching her mask.
To some extent, and
she doesn't know how to wear her mask very well. Not supposed to touch her face or her mask.
Duties, but do them in a quarantine fashion. So it's a big deal. I mean, it spreads out exponentially as you start talking to people, and this person was exposed to this person, and but we've been doing that for months now. I mean, the contact tracing with the preventive medicine and the public health folks, this has been going on for many months now in the United States. So
once again, this is terrible news. It's about midnight in California. 3 o'clock in
Certainly a development hitting home.
Washington and New York.
Jackson, the former White House physician.
People are waking up to this news.
Rear Admiral Dr. Jackson, thank you for getting
Very, very bad news this morning.
You bet. Thank you.
All right, we'll send it back to New York to Ashley.
Got to pray for our
Thanks,
president,
Cliff. And now
guys.
we're going to be speaking with Dr. Mark McCary. I do want to follow up on the contact tracing, the contact tracing that we were just talking with Griff and Dr. Ronnie Jackson there. So, really quickly, how well is this working? I know even, when I get off of planes, they have you fill out forms. I know it's a lot different with the president, but how well is this tracing working?
Well, generally speaking, it depends on the setting. So if somebody in New York goes to a contact tracer who works for the public health department, and they answer the question, where have you been lately? And they say, I took the L train to Grand Central Station, and then it's impossible. It's impossible to do contact tracing. And if you look at how New York dug out of their epidemic, we need to do contact tracing, but it was not contact tracing. In the White House, it's different. There's good tracking. There's good records of everybody who's had any interaction. If you notice, the president really has not been indoors with many people. The president on those outdoor rallies has stayed a distance. He's not shaken hands. He has not hugged anybody. He has stayed a distance. So I think that contact tracing is going to be critical for anybody who's been indoors in any indoor congregate setting. And they're going to do intensive testing. Now remember, when a member of the White House staff or somebody who visits the White House tests positive, that may not be representative of other positive tests we see out there in the world. because those people are getting tested so frequently, sometimes every day. So they may be detecting virus much earlier at a point where in other people out there, it may be undetectable. It may be simply asymptomatic and nobody really knows what's happening.
And as far as I want to go back to the mask conversation, for people who are just now getting up and hearing this news, you can see in this video that we're looking at right now, Hope Hicks, who has symptoms from COVID-19, is around the president. He doesn't have a mask on, but she was very adamant about wearing one. And forgive me, but I can't remember if it was you or a different doctor that I spoke to tonight about the 3-tier mask system, and some masks are just not made the same. It's certainly not going to hurt.
I'm gonna upload this. Might make another video here. Gotta upload this before it gets too long.